All right. Good afternoon, Kentucky. It is 5 o'clock, that time we come together every day to remember that we will get through this and we will get through it together. So say it with me. We will get through this. We will get through this together. One last time. We will get through this. We will get through this together. We're going to get through this because we have already shown that we have what it takes to defeat this virus, that this worldwide health pandemic is something that we can weather simply by being good neighbors and continuing to know that our actions impact everyone around us. I want to take you back. It was a couple weeks ago that I was talking about how this is this generation's challenge. And while at least it was my grandparents' generation, the greatest generation, that faced an adversary that they didn't know whether they could defeat. We have one here that we know that we will come out on top, and we know the duration is months, not years, unlike that greatest generation that wasn't certain of either success or the time that it would take. But still, we try to learn from that generation about those qualities that can help us as we take on our challenge. Those qualities of personal responsibility. What I do, I'm responsible for. That my actions and how they impact other people, that I am responsible for. That I don't simply get to do whatever I want to do, but that right now we are living in a period of time where we must each be personally responsible to protect one another. Of integrity. Of knowing that we don't get days off when it comes to this virus, and that we have to be true to ourselves and the restrictions, knowing the impact that they could have or that we could have on others. Work ethic. So work ethic isn't something that it describes showing up to something that you're excited for. It's about slogging it out, even when it's difficult, to get the job done. And that's probably about where we are in fighting this virus. At the time where we'd all rather be doing some other things, summer approaching, we'd love to be at graduations right now, but we are in the challenge of our lifetime, and we have to have the work ethic to complete our task and to ultimately come out of this when we do, having protected those around us. And finally, faithful commitment, that we are fully committed to defeating this virus. We're going to faithfully continue to do what it takes. You think about all of those qualities of the greatest generation that can help guide us here. Again, it has been almost a century since a generation, a group of people have been called upon to face an epidemic like this. But I know we here in Kentucky are up to it. We just got to keep it going, knowing that this is our moment in history and that people's lives depend on us. We're ready, and we will defeat it. Now let's just keep doing the good things that we are doing. So we're going to defeat this virus because of our personal responsibility, integrity, work ethic, and faithful commitment. And we're going to get through it together because we're going to follow the 10 rules that it takes to defeat COVID-19. We talk about them every day because we have to, again, have that faithful commitment to practicing them every day. So it's getting nice. Well, today isn't nice. It was really nice the last 3 days. And as summer's approaching and we're thinking about things that otherwise we couldn't do, and of course we can't do a lot of these things. We've got a deadly virus out there. But healthy at home, it's going to be just as important even when we are healthy at work. Remember, if you're not at work, you ought to be home. Let's make sure that we keep our contacts down as much as they can be. kycovid19.ky.gov. Again, this is where we're putting up industry-specific guidance. It's my hope that by the end of the week, we will have retail, which is opening next in our phase 2, which we'll talk about here in a little bit. And that by the end of this week or early next week, we'll have houses of worship. We have some really good participation from a lot of the associations out there. I've talked with the Kentucky Council of Churches the last couple days. an interdenominational faith group today, getting great guidance from all of that, wanting to have that buy-in, and we're seeing real positive feedback. The Baptist Convention also having provided some really good suggestions on where we get. Washing hands and surfaces, keep it up. Applying for benefits, we're going to have an update from Josh Benton today on unemployment, and prioritizing your mental health. Do not travel. We're going to address some of the issues that a federal court pointed out in a decision that ruled for us in terms of mass gatherings, but said that we had a few tweaks we needed to make. In a footnote, they said with just a few tweaks, everything will be okay. So we're going to get that done tomorrow, because I hope everybody out there is still concerned about somebody coming from a hot spot into Kentucky, not taking the time to ensure that they're not infected and spreading it. You know, we used to be worried about New York, New Jersey. Those places still have big outbreaks. So does Massachusetts. So does Philadelphia. So we're just going to do what it takes to protect us. For me, it's never been about lawsuits or court challenges. It's about doing everything I can to protect you and making sure that that sacrifice that you have made is not frustrated by somebody coming in from a hot spot and ultimately spreading it, causing harm to your family and your friends. So we always talk about the 10 steps plus the extra, the census. We need you to fill out your census. It only takes a couple minutes. It's really important. My senior advisor, Rocky Atkins, has a great video that's out there on this. I think we'll show it tomorrow, about the importance of making sure that we fill it out, because it's the amount of federal dollars that come in and even come into certain areas. So let's make sure we get that done. We were up to 13th. I haven't seen our current position, but I will tell you, if 2% of Kentuckians get online and fill it out, we would jump into the top 10 almost immediately. I'm excited to be at 13th, but none of us have ever been satisfied saying, yay, I'm number 13. So let's get up in that top 10. We're competitive people. We have competitive sports teams. We certainly can be competitive here when we get dollars for how well we do. And then we ask everybody, especially as this grinds on, to make sure that we model the type of behavior that we need on social media. And oftentimes, it's one of those things that helps keep all of us going. To see that there are people who are still finding joy out there, and that even in times of sacrifice, missing important moments, are still trying to spread the message that we are our brothers and sisters' keeper, and we've got to make those right decisions. Let's see what we got. All right. Every time we see somebody who has recovered, especially if they were on a ventilator, it's an exciting time. So thank you to all of our healthcare workers here, U of L Health, that have done a phenomenal job. You look at all those major providers, and there are a lot of reasons why we haven't just flattened a curve, but we have done it as well as we have. It's everything that you've done and everything you've sacrificed, and our hospital systems doing a better job than anyone could have ever predicted on number of days and outcomes. We are grateful to them. All right, this is, again, some of our frontline heroes. Here, one of our nurses at UK, very special frontline heroes that we did not appreciate enough. But I can guarantee you, we're going to appreciate them every day going forward. Oh, now here again is our children who've also had to sacrifice, missing out on the end of this school year. I know, missing their teachers. Speaking of which, it is Teacher Appreciation Week. I'm going to talk about that in a second. All right. Again, here's just an opportunity showing what we can do through our virtual means to continue to connect to our classrooms, to continue to provide important education and instruction. And again, we see more institutions, more houses lighting up green every day. Iconic places like Louisville Slugger. But you know, we've even got a few photos now that go beyond Kentucky that have seen what we have done in a couple other places. Can you pull that one up, James? Do you have it? The house? All right. He's going to work on that because I know that they had it, but we're going to have a photo a little bit later when it comes up that we've got folks as far away as in Minnesota that are watching what we're doing here, and they are lighting their homes up green as well. This shouldn't just be a Kentucky thing. It can be one we started. But remember, it shows compassion, especially to those that have lost loved ones during this at a time when that funeral or that grieving can't be the same. It's got to be harder than ever. This shows them that they are not alone. And I tell you what, somebody who is going through that, who needs to get out for a walk or a drive and sees 100 green lights lit up, that means something. So let's continue to do this, and we're going to have a lot of reason to do it today. Let's continue to ring our bells at 10 a.m. Let's continue to remind people out there, maybe they're living alone, which is even harder right now if you're living alone, that you are not alone, that we are all out there, and while we can't be physically together, we are all in it together, and we want you to get through it. We want you to get through it strong mentally, physically, and emotionally. We care about you. Every single Kentuckian has value. Every single Kentuckian counts. And we want to make sure that every Kentuckian that we can get through this gets through this and gets through it in a place where they're ready to rebuild and resurge and move forward. All right, so I mentioned that it is Teacher Appreciation Week. And our teachers, I believe, are the most important profession, though I'm going to put our healthcare workers up there with them, especially with what we've gone through. And let me tell you, I had a call today with all of our directors of our local health departments. They're doing an incredible job in this. We didn't appreciate public health as much as we should have. But our teachers hold the very future of our Commonwealth, where we're going, in their hands every day, or now on their computer every day. They work so hard. They don't get paid enough. And most often, they probably hear from parents when we're upset. But we so appreciate the job they're doing. I can tell you, as a parent with kids at home right now instead of school, we certainly appreciate you now. But what our teachers have done at this time of crisis is nothing short of amazing. Continuing to provide instruction and schedule at a time when our kids are suffering the same anxiety that we are, and of ensuring through our school systems that kids who need a meal get a meal. Millions upon millions have been served. It has been amazingly special. And so I wanted to bring my best ambassadors out today who could truly thank teachers in a way that I never could, at least at this point in my life. So here are my two kids, Will and Lila.
Thank you to all the teachers in Kentucky who have put all the hard work into their classrooms.
And a specific thanks to our teachers, Miss McCormick and Miss Ringo, for putting our learning first and for spending so much time on meetings with other teachers and for posting new assignments on Google Classroom for us.
Happy Teacher Appreciation Day.
I should have said that was Will, Lila, and Winnie in the background, who these days does not stop barking ever. I want to go straight to the numbers today. We're going to start doing them a little early, and I'm going to have to explain the numbers today. They're high, but they're high for a reason, and so this is one of those times where we're going to have to breathe, and we're going to have to put it all in context because it shows us again where we have some very difficult spots that we have to work on, but in the overall population, when you average things out, still pretty stable, but still a dangerous world out there right now that we have to be careful in the decisions that we make. So today, we're reporting our highest number of cases by a significant amount. It's 625 new cases. But the way that breaks down is 309 of those new cases are from Green River Correctional Facility alone, about half. And what we have done there, which we talked about, is we tested all 1,000-plus people who are incarcerated there or who are working there or who are on contract coming in to the facility. And what we have seen, and Michael Brown will talk about it, is almost 400 people total between before and this batch have tested positive to at about a 40% rate, which is what we hear from other states at those facilities. It says that this is a concerning situation at that facility, but also the steps that we talked about yesterday that we'll repeat are some of the right steps. So 309 positives from Green River today, and so 316 other positive cases. Now remember, if you go back to Sunday, we had under 100, which we knew wasn't a regular day, and Saturday and Monday, again, we're a little below where we see our plateau. Each Tuesday, we have seen as tests roll in, higher numbers, though this one is higher. Last week was about 240-ish. So again, it's a lot of positives, but we are going to see some more positives as we go out and we test everybody in a long-term care facility, which is what we are going to eventually do. And any other correctional facility that we go into, we're going to see this too. And a whole lot of these cases are asymptomatic, and that's what we start learning about. But it does say that the steps that we are now taking at Green River are necessary. Let me go through the new cases by county. It's 310 in Muhlenberg. That's where the Green River Correctional Facility is. 95 in Jefferson, 42 in Warren, 27 in Kenton. And let me go back. Warren has had just a significant growth in cases. It's from a lot of different reasons. We're going to work with them to make sure that we have some form of continued testing, at least regionally. That's going to be needed after this week. I believe we're going to have one that's at least close by, but we got to look on how to work with that community to continue to provide support. Judge Buchanan down there, county judge, I know is working really hard, and we want to work with him and with that whole region, because remember, most of the major hospitals are right there. So not all those are probably Warren County residents, but Warren County is servicing from a healthcare perspective a much broader region. 27 new cases in Kenton, 22 in Davis. In Davis, remember, we tested last week through Kroger, and we've been supporting their own testing program this week. 20 in Boone, 14 in Butler, 12 in Bullitt, 11 in Edmondson, 9 in Ohio, 7 in Grayson, 6 in Campbell, 5 in Henderson, 4 in Fayette, 3 in Barron, Hardin, Simpson, 2 in Allen, Graves, Hart, Knox, Laurel, Oldham, and Shelby, and 1 in Anderson, Christian, Grant, Hickman, Hopkins, Jackson, Jessamine, Logan, Madison, McCracken, Nelson, Rockcastle, Spencer, Todd, Union, and Webster. So a lot of cases today. When you look at Green River separately, we have one of our highest days, averaged out over the 3 days. Still a little high, but still within about the range that we are seeing, knowing we're going to have fluctuations. Total tested to date, 61,013. And we're looking back over that number. We actually don't believe we have had all of the negatives reported to us. We don't now get information on them, but we believe, based on the number of tests we know we've been sending out, that we're not getting the full number of total tested coming back into us. I believe that number is higher. Total number hospitalized, 1,603. That's ever hospitalized, not right now, ever hospitalized. Currently hospitalized, 347. Ever in the ICU, 685. Currently 189. That's up. It's up about 10, I think, from some of our last numbers. That's a lot of people to be in the ICU, fighting for their lives and their survival. So let's make sure that we are thinking about them. Total number of recovered keeps going up, 2,058. We also had a really hard day on number of new deaths. So today we're reporting 14 new deaths related to COVID-19. These are our 14 individuals who are loved, who are special, who are important, and who are Kentuckians. And the loss of these 14 is a loss to all of us. And we're getting to the point where just about everybody knows somebody or has a connection to somebody that we've lost. That's what we're dealing with. I know it's happened to me, and it's happened to so many of you out there. So you know that each individual is more than an age and a gender and a county, but that's the information we report each day. So a 63-year-old female from Jefferson, a 69-year-old female from Jefferson, a 96-year-old female from Kenton, an 88-year-old female from Kenton, an 86-year-old female from Kenton, a 77-year-old male, Hopkins, an 89-year-old female from Boone, 94-year-old male from Kenton, a 59-year-old female from Jackson, a 91-year-old male from Jefferson, a 79-year-old male from Boone, an 85-year-old male from Henderson, a 70-year-old female from Jackson, and a 35-year-old male. 35-year-old male from Jefferson. So let's remember what we're dealing with is serious, and let's also remember that people are hurting, and that lighting up our houses green, being there, making a call, reaching out if you know a family that's lost somebody is really important right now. When we go back through and we audit our numbers and ensure that we don't have duplicates in others, our total cases from the state is 5,822. One of those is a probable, the others are lab confirmed. Total number of deaths now reach 275. One probable, 274 lab confirmed. 275 Kentuckians, 275 more than we ever wanted to lose. We'll continue to do our best each day to follow each of these rules, regulations, restrictions, especially the new ones as they come out. I'm going to continue to wear this mask when I'm in public, because if it means that but for me wearing it, that there would have been 276 today, it was worth it. If it means just 1 in 100 shot that there would have been one other person today, it is worth it. I'm going to continue to do it because each of these 14 and each of the 275 individuals are special Kentuckians, and we ought to be doing everything we can to ensure that we lessen the loss that we're going to sustain through this. Breakdown of ethnicity and race of overall cases: 74.5% white, 13.27% black or African American, 6.45% Asian, 5.6% multiracial. On ethnicity, 88.26% non-Hispanic, 11.74% Hispanic. On deaths, 78.51% white, 18.18% black or African American, 2% Asian, 1.24% multiracial, and then deaths, 98.22% non-Hispanic and 1.78% Hispanic. I want to go through quickly the long-term care numbers. Then I want to bring up Dr. Stack to kind of comment, given today's numbers. Then we're going to hear from Michael Brown on Green River again to go over some of the steps that are being taken there. Long-term care, 16 new residents have tested positive, 10 new staff, and 13 additional deaths. Remember, many of today's were in a long-term care facility. This is what the virus does. And while we have so many heroes in these facilities or in our hospitals working to save folks, this is what the virus does. And this is why we got to continue to take the actions that we've been taking and not let up, not even for a minute. Dr. Stack.
Thank you, Governor. So when we look at the overall numbers, and the Governor points out accurately that we've had what seems to have been a plateau in general sense for the last number of weeks in absolute numbers, that's correct. But when we go and do focus testing, we find here in Kentucky the same thing that my colleagues in other states are finding. So the Governor's shared before, he communicates with the governors from other states. I communicate with the state health officers from other states on a regular basis. And so when we go in and we do focus testing, in confined populations. So long-term care facilities or nursing homes like is on the slide currently, prisons like we did at Green River Correctional Center, also in some of the meat processing and poultry plants. What we find is in these confined populations, the positivity rate is much higher. With younger populations, folks tend to do pretty well, like we've said, although not all the time. And so there have been those sad and tragic stories of young people who've died from a variety of complications related to COVID. But we know that it is particularly dangerous. It's particularly hard on individuals who are in their 60s or older and people who are particularly overweight and have chronic medical problems. And so the overall numbers have been good, but when we say that we have to keep up a number of these initiatives to maintain social distancing, to use masks like you see us all coming up here with and removing only to talk to you at the camera, we have to do these social distancing steps because we are seeing the disease very active. It has not disappeared. It is in these populations. We are about to embark on a very aggressive program to test long-term care facilities over the weeks ahead at a very brisk pace. Additionally, as the governor had shared before, I've been in communications with leadership from Purdue talking about their plant in Ohio County. I'm very grateful to them for the dialogue we've had. They are going to test the entire factory tomorrow. And so we should have information over the next few days, and then we'll work with them to come up with mitigation plans and to try to engage with the local health department leaders, the state health department, and also the Purdue leadership to try to come up with plans to help keep their workforce safe and help keep the communities they go home to safe. So I have to, again, thank you for what you've done, but I have to continue to emphasize that we must continue these efforts even as we are trying to ease healthcare back into a better level of functionality, and even as the governor has announced phase 1 reopening plans. And we'll look to a longer horizon to find ways that we can normalize as much as possible our activities. The normal we return to will be a new normal. It won't be the same normal we left until we get access to a vaccine or until we get access to a fantastic treatment or cure. There are none of those yet at this time. And we really look forward to the scientific community hopefully having some breakthrough on the treatment front. But even though we're having progress on the vaccine front, it is still not going to be until the earliest 2021 at the start before we have something we can use for the whole population. So thank you for all you've done. Thank you, Governor, for continuing our efforts. This is not easy. The sacrifice has been great. We know that. This has not spared anybody the sacrifices of the economic difficulties or for the medical difficulties. Most people are familiar with someone who has had this infection or who has had, unfortunately, a bad outcome. But what we have done has saved lives. I have no doubt about that. We have saved thousands of lives in Kentucky by taking the actions we've taken. And I think as Team Kentucky, we can all be very grateful for our neighbors acting with neighborly love and concern for each other to take what have been admittedly very difficult steps. So thank you very much, Governor. And I think Secretary Brown is going to come up here next and give you an update on Green River. Thank you.
Do you have a number slide? All right. Update on Green River, and just put things in a little bit of context. We had our first test come back positive at Green River on March 25th. That was 2 staff. Then on March 28th, we had another 2 staff come back and report positive. Exactly 30 days ago, we had our first inmate case that came back, April the 5th. Last week, with our concentrated testing, we were able now to have a total of 1,081 total people tested at that facility. And now, because we have 1,029 of those tests returned, we only have 52 remaining. What that means is we almost have a complete snapshot of the situation at Green River, which allows us to go ahead and truly plan for how to address that population down there. Now, yesterday I talked a bit about how we were going to go about address it, and that's in addition to the thermometer checks and the desanitizing that's going on. But we're able, because of the layout of this particular facility now, if these numbers hold about where they are, we can isolate individuals into 3 main groups and then one other group. And those 3 groups will be positive, those who have tested positive, and we can get them basically now pretty much in one building, one area. Those who have tested negative but who have had exposure to others who have been positive, and again, we can get them all in, looks like one area. And then those who have tested negative but without exposure to any that we know. A 4th group would be those who are vulnerable, and we can completely, vulnerable but negative, we completely separate them from the rest of the population. So we're waiting for these next 52 results to come back in. The snapshot will be complete, and then we can really follow out this plan to try to contain it where it is. We'll be able to treat. Now, we have 4 individuals right now who are in the hospital, 2 staff and 2 inmates, 1 inmate in ICU, 1 staff in ICU, and we've had 2 deaths back in April from COVID-19, and we have 1 who is potentially COVID-19 related that just died over the weekend. And that's our update. I was on the phone today with all the officials from both health and corrections, and we know that this plan is being implemented as we speak. Thank you, Governor.
All right, let's go over a couple of more areas, because each day it's important that we talk about testing. So moving to a healthy at-work phase requires us to continue to increase the capacity of our testing. And if you look at where we are in the state with the number of drive-through testing sites that are available this week, we're now up to about 18 different sites. I mean, you look at where we were before and where we are now, we have experienced very significant growth. And what we've seen is partnerships with Kroger, with Walmart, with Walgreens, and then we see a primary care center of Eastern Kentucky is actually doing this entirely on their own with a private lab. They're doing about 170 a day in Hazard. Let's keep that up. Christian County is doing it through their local health department. And they did 90, I think, in the rain just yesterday in a couple of hours. So they're doing great work. But if you go onto our website, you can get how to sign up for each and every one of these. But we can provide all the capacity in the world. You've got to show up and to take a test. We're going to need to test about, we think we can get up to about 3% of our population every month. And to do that, we've got to have the capacity, the locations. We also have to have you being willing to do it. Now, we have a new testing site to announce today. They've been doing it, but we've added them to our group, and that's Pikeville Medical Center, which does a great job. One of the largest, I think it is the largest employer in Pike County, is doing Tuesday through Friday of this week. It's available to everyone, no registration required, limit 70 tests per day. The last day that we did Pikeville through the Kroger, when again we removed any requirements and everybody could be tested, I think we did almost 500 people in a day. So 70 a day in Pikeville, Tuesday through Friday. Let's make sure we fill those up, and we still have a few spots left in Ashland this week. My hope is later in the week that we're going to be able to announce another big partnership that can continue to increase our numbers in Kentucky. And I believe that one will be an entirely private partnership, which is a big difference between us and other states, as we are primarily state-driven in our testing, need more private partners that are able to source both kits and PPE and to perform the tests themselves. To give you an idea on where we are on some of our Kroger sites, today by 4 o'clock we'd done 294 in Shawnee Park in Louisville, 280 in Lexington, 271 in Bowling Green, and 307 in Ashland. Still a lot of time left. But we can't allow weather, a bad weather day, to keep us from keeping an appointment. Let's make sure that we get each and every one of these tests done. Louisville and Lexington are fully booked in Kroger, but remember there's a Walmart and a Walgreens in each. Bowling Green fully booked. Ashland, we still have about 100 spots left on that last Thursday. Healthy at Work. Let's just go over very briefly, since next Monday is coming up, the schedule starting May 11th for Phase 1. I hope that we can announce Phase 2 this week, Phase 2 being in June. We're working on it. We are very close. This is where we are on Phase 1 starting next week. So next week starts with manufacturing, there we go, construction, vehicle dealerships, office-based businesses, horse racing without fans, pet care, grooming and boarding, and photography. There is now specific guidance up for each of these areas on the website. You meet those guidance, you can open coming this Monday, and we believe you can open safely. So again, this is May the 11th. Let's move forward to the next date, which is May the 20th. I'll do it from down here. There we go, May the 20th. We're hoping to have this up at the very latest on Monday, specific guidance for retail and for houses of worship. The last 2 days, I have had calls or Zoom meetings with major leaders of our houses of worship across the state, and each one has said the same thing and asked me to say the same thing. Just because May the 20th you can potentially reopen doesn't mean that you should. It has to be done safely. And each of our leaders have asked me to reiterate, and I'm happy to do it, that on this you need to trust your faith leader in your congregation about when it's going to be safe to resume. My church, Blugegrass in Louisville, has already said that they are not going to reopen to in-person services on the 20th because they want to make sure that they get this right. So again, there shouldn't be pressure. There shouldn't be pressure from a congregation. This should be about when the leadership believes that we've had time to educate the congregation because there can't be handshakes or hugs, time to look at the facility and make sure family groups can be 6 feet apart. It's gone through all aspects of the service to look at what might help or prevent the spread, and be able to get the type of deep cleaning and other steps that not all churches have had to do on a regular basis or perhaps even ever. So I want to make sure that, again, these dates are a can, but you got to have your own timeline for meeting the safety standards. Because remember, if you can't, then it's going to be tough to stay open. And if you can't and the virus spreads, that's going to cause more long-term damage to your business, to your institution, than anything else. And let's put up the last one. Again, I hope you look at this and you see there's hope ahead. There's even hope of getting together with people socially, which I know that we have all missed and that we could all desperately use. Help us to make sure we have the time and we're able to do the mitigation steps we are, that between May 11th and the 25th, we get used to our new normal when we see people, things like masking and other steps that we need to take voluntarily, or if we're at work, it's going to be required. And then the ability to open up some additional services then. I hope by the end of the week, if not earlier, that we will have our Phase 2 for June. We were working on it today. We have to have a third plan on government reopening. We have had healthcare, which needs to lead. We have business, and then we will need government. So we're working on all those. Next, I wanted to get an update. Well, first, I missed the sign language lesson today. See, I make mistakes too. In fact, I make at least 3 in every single one of these. But today, being Teacher Appreciation Day, we wanted to learn thank you, teachers. Okay, thank you, teachers. One more time. Thank you, teachers. Thank you for teaching us, Virginia. All right, now an update on unemployment. Josh and his staff have been working really hard. None of us are satisfied about where things are. I know there's a lot of tough, and they're not stories, they're realities of people out there. Even with the historic number of claims, if you haven't been helped, we haven't done a good enough job. I'll own that, and we'll continue to work. So, Josh Benton.
Thank you, Governor. 3 specific updates today on unemployment insurance. One relates to pandemic unemployment insurance. The other is going to be a discussion around returning to work. And then the third is an important just piece of information for those individuals, specifically in March, who have not had their claim approved yet. So we'll talk about that to close up. So first, pandemic unemployment assistance. That is primarily individuals who did not typically qualify for unemployment. There's about 100,000 of those individuals that are receiving benefits right now on this program. There's some changes coming to the end of the week for those individuals. One, we'll say the bad news first. The U.S. Department of Labor sets the minimum benefit amount for pandemic unemployment assistance. The original benefit amount was $180 a week. They are decreasing that to $176 a week. However, the good news in that scenario is that individuals now on PUA will be able to submit their earnings from the previous year. That is going to allow us to do a monetary determination on those benefits, and in more cases than not, it's going to increase their benefit amount above that $176 a week. Also, within the system, the UI system and their account summary, it's going to have more detailed information about their payments, when they can request a payment every other week. All of that is going to be updated by the end of the week. We are sending out information this week via mail, via email, and we'll also have the general information on our website so that individuals on PUA will be able to know what they need to do. But that information is going to start, and those updates will start by the end of the week. The second thing that's going to be a change by the end of the week is the ability for employers to report return to work dates for their employees. The governor just referenced phase 1, and several employers starting back on May the 11th. So employers are going to be able to go to kewes.ky.gov to report return to work dates for their employees. Now, there are some exceptions to this. An individual who may get called back and receive a return to work date, if they do not have, or if they are taking care of a dependent because the facility that takes care of their dependent is still closed, that individual can stay on unemployment insurance. Also, if that individual is in an at-risk category, either because of a health issue or of age, they do not have to return to work. They will be able, when they request their payments, to say that they cannot return because of those issues. They will self-certify, and that will be added to their file. So those are 2 big things. Then the last piece of information that's going out tonight, specifically for individuals who have not been approved for their March claim yet. We've narrowed down that the majority, like 95% of the folks left in March, have not been approved because they either identified that they were discharged from their employer, meaning they were fired, or that they quit. We've received all of the employer protests for those individuals, and so we know that the group of people whose employers did not protest their job separation, yet they identified that they quit or that they were discharged. So we view that as potentially a mistake when they were completing their claim. We are sending out an email tonight to all of those individuals in March so that they can make a modification to their claim and identify the issue for their separation and identify that their separation was COVID related. When that happens, it will allow us to clear up a lot of the issues that we're seeing. Then we'll move on to the individuals in March that fall into or in April that fall under that category, so that we can methodically clean up those cases and get more people who are eligible paid for their benefits. With that, our most up-to-date information on the number of initial claims that we've received, the information was released by the Department of Labor last week, is approaching 600,000. We're going this week as well be able to release some more detailed information by county unemployment rates. So a lot of more information coming and some changes coming this week for people on pandemic unemployment assistance, those returning to work, and information going out tonight for those whose claims have not yet been approved in March. Thank you, Governor.
All right, just two more quick things, and then we'll open it up for questions. First, we've heard from some that are working on reopening that it's difficult to get certain supplies. That's the challenge of all this. It's the challenge of reopening during a pandemic. And again, you have to have the necessary supplies. You have to meet the requirements to reopen. But for those, especially that are struggling to find hand sanitizer, I want you to remember this partnership between us, the Chamber, and the distillers, where our distilleries are producing significant amounts of hand sanitizer. This is one that we ought to be able to solve, that you ought to be able to ultimately order and get what you need, because we've got a supply of this thanks to our distillers in Kentucky that might be the envy of a number of other states. Last, it's Giving Tuesday. And so we'd ask for those that have the ability right now to be generous in helping those that need our help. For us, the Team Kentucky Fund is the method by which we are doing it to make sure that we can help those in Kentucky that are struggling, and those that are going to be struggling going forward, knowing that our reopening is gradual and we're going to have to rebuild and restart our economy. And this fund and many others is going to be important to helping people as we are able to restore, to rebuild, and I hope in the short term, not the long term, to be stronger than ever. Team Kentucky Fund has been supported by so many, and we appreciate each and every one of you. All right, so today we have 4 journalists with us live and a number of questions that have been sent in. We've got Ryan Van Velzer from WFPL. Lawrence Smith is back from WDRB. Joe Sanka is here from the Courier-Journal, which just won a Pulitzer Prize. Congratulations. I've never won a Pulitzer Prize. Feel pretty good? All right. And Phil Pendleton from WKYT. We'll start. Phil, you've been outside a couple days, so you want to kick us off?
An update on the Team Kentucky Fund as far as how much money it's raised, and also where is that money going to go to, and who is it going to help?
Right. So it's raised a little over $2 million. Our partnership is with CAK, which is provides help on a regular basis. Things like utilities, food. They are going to be our primary provider. They already have a network of those they know are in need, and connections with the areas that those who are now in need go to. So we're going to be working with folks that do this on an everyday basis. We're going to have a regulation that's going to be out on that, and then those dollars are going to start flowing at a greater rate. I will say that one of the errors that is often made when we see disasters, though none of us have necessarily dealt with a pandemic, is everything going out all at once. When we know that there's going to be damage over time, and making sure that we're doing it in a sustainable way, knowing that people are still going to need help a month or two from now. Covering Ashland's test site today, is there a way to get a breakdown of how many slots are available each day? I think we went over that, but let me pull that back out. I know we are booked in Ashland for Tuesday and Wednesday, but on Thursday, we have about 100 slots that are still left open, and we want to fill every one. Ryan?
Governor, today we had the highest number of confirmed cases. Overall, cases have plateaued. You said you want to test up to 3% of the population per month, but we're not there yet. You have plans in place to improve contact tracing, but I don't believe you hired all of the necessary staff yet. The vast majority of Americans have not been exposed to the coronavirus. They don't have immunity, and the initial conditions that allowed the virus to spread haven't changed except for social distancing policies. You yourself said on April 20th that we need to see 2 weeks of declining results in line with White House recommendations before reopening. Governor, we don't appear to be meeting the goals that you laid out. So what's changed in your thinking?
That was a paragraph. I'll try to answer the question at the end, but with all the stuff that you threw out, I mean, you'd have to have individual responses to some of those pieces. I believe that we can safely engage in phase one at Healthy at Work. Here's the reason. We have increased our testing capacity just with gravity to about 30,000 tests per week. If you look at that, that's 120,000 tests per month, which exceed the 88,000, which would be the 2% that the White House is now recommending. We now have 18 sites that are up across Kentucky, and some of those aren't even using our gravity testing. We're starting to engage in larger scale testing because we got to test different populations. We just did 1,000 tests over 3 days in one facility, and we have a program launching with our long-term care facility. So I believe that we can significantly increase our testing, that our components are there, and for the first time, we have the materials to do it. Swabs, which is what goes up your nose to get this test, have been the greatest limiting factor. Now it looks like we have both significant amounts of swabs coming from the federal government, which I'm grateful. That's something that has opened up. And we also believe we may have had a breakthrough in how to manufacture swabs. So the challenge that's left in testing is to have it regularly done. But we believe certainly by the time, if people were getting the virus starting, going back to work May 11th, that they might test positive, that we're going to have that capacity in place. It's also a reason that we are doing this gradually. Some other states have said everything can start at 50% capacity. This it would have been yesterday. We know that we still have steps to take, and we're giving ourselves time to get there. We also know the way that testing is done is going to change over time, that we're eventually going to get to a blood test that is probably going to be performed inside hospitals and medical settings, and also the settings we've created. So getting healthcare started early is important to boost that capacity. Contact tracing, we had a great call with our local health departments. We believe that they can carry the load through the first week or so. Our RFP is due on Friday. We are going to award that early next week. We're going to expect for people to be up and running with the initial training right after that. And they're going to ultimately, on their cases in an area, answer to or collaborate with the local health department, which is going to be making sure that all of it is done correctly. They know how to do it. They do a phenomenal job. We're going to rely on them to lead the individuals that are helping out in their district, and also assure a quality control that I know that they can bring to the table. It's not the way we'd want to staff up if this were something that we could make permanent, but it's something that we got to do really quickly, and the money has to be spent before December 31st. It's just the best step that we can take to get there. There are a series of, and let me finally talk about number of cases. So we're going to have to really look at the data, because we know if we're testing vulnerable populations, we know if we go into prison or nursing home, we're going to have a lot of cases. So we got to look at that, not totally independently, but we've got to look at it in one bucket. Then what we've got are a general plateau of cases while we are testing more people. And in the general population, we believe right now it's at a level where if we take all these precautions, we can do this safely. But we're watching the numbers every day. Now remember, on Sunday we had 80, 70, And we knew that that was artificially low, and we weren't going to make some big change because of it. Today, we have one that we know for certain reasons is artificially high. Some came in from other days. Some's based on a prison we knew we had a big problem with. So I believe that we can do this, but I'm not going to be afraid to pause things if we believe that we're not ready or the situation is dangerous. That was a long answer, but for a long question. There are a series of demonstrations planned by several state senators and representatives who want the state reopened immediately. What's my response? That would be dangerous. We believe we have a gradual, healthy at-work program where we can try to protect people at the time of a pandemic. And we just saw a demonstration where they said, take off your mask, don't get the vaccine, and social distancing is voluntary. Please, if someone is planning a demonstration, don't do it that way. Do it safely. Do it in a way that you can get your point across, and it's your right to get your point across, but make sure you don't put other people at risk during those demonstrations. Part of leadership is knowing even when you want to get people on your side, you got to do it in a way that doesn't harm them. Lawrence?
You, Governor, had talked about speaking with Indiana Governor Holcomb about the cities across the river from Louisville. Did you have that conversation, and what was your request or conversation about those cities?
Still working to connect with Governor Holcomb about the differences in Indiana and Kentucky, and especially on the restaurant side, which we're trying to make plans for and we're working on right now. Need to note the need, if we're in Kentucky, we're doing this better than just about every state. Please don't cross state lines to do something that we believe we need to gradually reopen. And today's numbers, while we still believe we can move forward on healthy at work, ought to be a wake-up call that there's still a very dangerous virus out there. We don't deny that at all. I did talk to Ohio's governor today, Mike DeWine. We talked pretty frequently and did talk about the need to frequently touch base, knowing that our borders, we ought to be talking through a lot of the dates on various areas, and we've been talking a lot as we've moved through this. At the end of the day, every governor's responsible for their people, and I think we're all trying to make the best decisions we can, and time will tell which one are the right decisions. But I would rather be remembered as someone who was measured and who made decisions that he believed would protect his people, as opposed to one that gambled on going too early, too big, too fast. All right, several child care centers are reporting that liability claims are being denied, and this is one where insurers are saying that this shutdown isn't covered. I wish that those insurers would change their mind. I wish that, and we've got to take a good look at that from our end. I think there are other state officials that could take a look at that. We need a challenge in all this, and we're looking at ways to safely reopen child care in phase 2. We need to make sure we don't lose our child care capacity. Just because we don't believe it's safe in phase 1 doesn't believe that we don't believe it is critically and vitally important in the Commonwealth. We do. And if we're going to rebuild our economy, having that capacity still in place, having those professionals ready to come back to work is also really important. You are really important. And we're going to work as hard as we can to find the best solution to get child care rolling as soon as we can. Joe.
You just mentioned the death of a 35-year-old man. I believe that's the youngest death that we've had in the state so far. I know you can't reveal that person's name, but can you say anything about that person's background or medical history? Because that's a very different age than the ones that you usually read.
The question's about the 35-year-old male from Jefferson, and do we have any health information on him? I don't at this time, but we'll look into that. It is. We did have a 42, 45-year-old from Ashland who had very little underlying conditions. That was early on. He died, I think, in Detroit. We talked about him one day. Yes, but this, I believe, is the youngest that we have had, or close to it. We may have had someone in their late 20s that had a significant underlying condition. But this may be, Kelly, we think this is the youngest? It is the youngest. Okay, we had a 39-year-old that I was thinking of. Few notable cases of violence, and at least one security guard in Michigan died while trying to enforce other mask-wearing measures. What should law enforcement, security guards, employers, or others do to enforce a recommendation here? So for employers and employees, this is something we've got to do if we're going to be going back to work. Otherwise, out in public, this is a strong recommendation, but this is how you make sure your actions don't kill somebody else. Plain and simple. I wear this because it means I am less likely to infect my kids, and I am less likely to be infected and infect my kids. And I'm less likely, if I'm asymptomatic, to infect anybody else, not knowing where that could go or how much they could be hurt. But for somebody trying to enforce this, for somebody to commit violence against them, we're better people than that. And I know there are some that may have strong feelings on this, but is it worth killing somebody? No. And violence can't be our answer to disagreements, even in a time of a pandemic. We got to be better than that, regardless of where we are. Not just Kentuckians, but as Americans. And we are called upon to rise to this occasion, and to take it out on each other with violence is reprehensible. Phil.
We've had several people ask us about, with the courthouses being closed, if they lose their driver's license, what are they supposed to do? Especially, and also too, some places do not accept an expired driver's license when they have to show it to buy something.
Well, it's about driver's license, and through an executive order or through the board, we have extended everybody's driver's license by 3 months, I believe was the initial one. So nobody's license should be expired yet under that order, and that order should have the power of law. We're going to look to do that again as we talk with our clerks about opening, because that's can be a high trafficked area, especially when people need to re-up their license, and we need to make sure that they're in a crowd or a line as we reopen courthouses. And I want to make sure that the clerks are able to weigh in on the safest way to do it. And if it's a reissuance and it can be done virtually, everything ought to be done virtually if it can, even when we head back to work. And for those employers on May 11th, anybody who's teleworking and it's working out ought to continue to be teleworking. Guidelines for reopening business, who is enforcing them? We're going to see enforcement out of the Labor Cabinet. We're going to see enforcement out of local officials, but you don't have to submit a plan to reopen. Your industry is going to have guidelines. Now those guidelines come from the proposals. They are incredibly helpful, and what we found in most of these situations is the vast majority of the requirements have even been suggestions. Ryan.
Governor, if I'm understanding you correctly, you're saying that we're not going to wait for a 14-day decline in cases because you think that the plan that you've offered will protect Kentuckians as you move to reopen. What does your internal modeling suggest is going to happen to the number of confirmed cases as businesses reopen?
We believe that Kentuckians have shown that they can follow the rules and regulations of being healthy at home. The people of Kentucky, actions have done more to flatten a curve than we ever thought was possible in a pandemic. You have rewritten the rule book. You have rewritten all of the modeling. We would expect that as people go back to work, we will have some more positive cases because we will have more people tested. We believe as an overall rate in testing that we can hold it steady. And if we see a spike in cases, if we believe that we see deaths that are related to work, we'll be willing to pause and to reevaluate as we go. Listen, all of this is people doing the best we can, trying to make the best decision we can, and balancing the best rules and restrictions with what people are willing to do and trying to get the maximum compliance out of Kentuckians. They have done an amazing job, but we do need to get some people back to work, and I'm just trying to do it as safely as I can. Lawrence.
Will you comment on the Bluegrass Institute's criticism of you for maintaining personal staff at the mansion when others cannot do that?
Well, so the question, there's a group called the Bluegrass Institute, and said that state employees at the mansion, I guess, should have been laid off or furloughed, like maybe has happened in the private sector. No state employee has been laid off or furloughed. The state plan has been to reduce employees by over 50% and everybody else work from home. The folks that work at the governor's mansion are state employees just like everybody else and shouldn't be treated any better or any worse. They have fully abided by the guidelines, the requirements that are out there with state government. But these are state government employees that are governed by state government laws. What you would have to do to meet what the Bluegrass Institute was saying would be illegal, because you got to go through a big plan if you're going to ultimately lay people off or furlough them in government. It is political, and I'm done with that. I don't know if I can ever go back to it. And we've had to make decisions that I never thought that we would have to, but we've also seen people come together that I never thought would. This thing doesn't care about party, and it doesn't care about your poll numbers, and it doesn't care about the upcoming elections and any type of attacks that are on that. I mean, we're in a worldwide health pandemic. Let's do a little better than that. All right. Other day I said I'd like to test everyone in long-term care, but that would require some triage. That's right. How's the triage going, and where do assisted living facilities and personal care homes fall in the pecking order? My understanding, but we can get a report on this coming up, is that we are going to start with those that are most at risk, where we have seen any positives, but those that are most medically fragile. And yes, it's going to take a triage that we're going to have priority to get through that. And one of them has told us they have trouble finding a doctor to give order prescriptions for test kits. Well, we're going to do a lot of this testing, but we can also now connect. We have some additional capacity out there. Solaris in Nicholasville. If anybody out there is looking for a testing protocol in a business, is looking for significant testing, it's there. In fact, I believe that that's the company that's going to partner to test the Purdue plant. And so they're able to bring some significant capacity to bear. This wouldn't have been possible a month ago, not even close, but it is possible today. Joe?
Did the state wait too long to test every inmate at the Green River prison? And if the state waits until there's an outbreak at a prison to do mass testing, is that also too late?
The question is, did we wait too long to test at Green River? I believe that we knew, we had testing that showed that there was a real problem and challenge at Green River, that the steps that were taken were the steps that were recommended by public health officials, and the public health officials all over the country were recommending. I took the extra step of asking everybody to be tested, and I will tell you most governors out there aren't doing those with prisons. I thought that with the situation where it was, now was the time to take a very significant step. And with the leadership of Michael Brown, who used to be the Justice Cabinet Secretary, knowing that facility in and out, being able to come up with a plan to significantly move people in the facility. Now, I will tell you that that plan is one that a lot of correction systems wouldn't do because, this is a pretty significant institution. Those that are in it, most of them are serving some pretty significant sentences. And when you start moving people out of cells where they get along with their cellmate and into totally different environments, it can be a little dangerous. But we've got to go ahead and take that step to protect those that are inside. We believe that some steps that are being taken all across our prisons also are the right steps. There's not the testing capacity to go in and to do this with the numbers that they are at, all of them. But we do believe that we will see the signs, like Green River, that there is an issue. But the steps that are being taken at Green River are also being taken at a lot of other places. And additional steps of actually putting eyes on somebody every single day, I think is going to help us as we move forward as well. As school ends for the year, do we expect a spike in cases as many decide to travel or venture out more? Folks, if we're traveling, it's still not safe. We had a significant outbreak based on folks going to a beach and coming back. It's right now is one where we want you to be healthy at home. We want you to enjoy this first part, the last part of spring and the first part of summer. But traveling to other places is still dangerous. Let's try to go through one more time. Phil?
Do you think people basically, if they have any vacation plans at all this summer, they should cancel those plans?
I believe that people should think very carefully about their vacation plans for the summer. Our hope is that we can open up some state parks. Obviously, from our perspective, that's safer because it falls within the state and falls within all the guidelines that we've been doing. And we can make sure or do our best that people are social distancing, which is what I would want if I was going somewhere for those plans. Admittedly, it's going to be a different summer. We think it's going to be able to open up. Remember, May 25th, groups of 10 or more, and hopefully in June, we'll be able to do more than that. But we'll probably have, it'll be later in the summer that we can do more things. And then remember, we think that there may well be a fall spike that's coming as well. Is there a way to get the state parks opened even if the campgrounds aren't so people can get out and enjoy the great outdoors this spring? That's something we're looking at. And remember, we had to shut down many of them because of people not social distancing. So when we'll take that step, it'll be hoping that we've all bought in now. But again, it's one that we've got to monitor and then address as it goes. Ryan?
Are you receiving pressure from the federal government to reopen, and how does the impact on the state budget affect your decision to reopen?
Am I receiving pressure from the federal government to reopen? No. And is the budget pushing me to reopen? Also, no. We just believe that we are at the point in time where we have got to reopen, but in a slow and gradual way. And I think when you look at our plan versus many others, we're being careful. Lawrence?
You mentioned earlier daycare. Can you talk about what metrics you'll be using to make that determination? That is one big issue that's going to prevent people from going back to work.
Yeah, the question's on childcare, and Lawrence is right. I mean, it's tough. I mean, when a business opens up, but childcare isn't open yet, that's really hard, and it makes it very difficult, and it's not fair in the least. So we are working in phase 2. Looking at best practices done elsewhere. It'll be very different. It's going to be much smaller. It's going to be much more spread out. But we want to make sure that we get this one right, and we don't have it right yet. And so I can't give you any specifics until that final plan comes through. But James, if you can show that graphic we did just 3 or 4 days ago, just when you look at the overall number of contacts, we couldn't have a gradual reopening if we included daycare right in the beginning. Because a gradual return to work in, say, an office-based environment, you could be increasing your contacts by 40. But if you did that with daycare and everybody having the ability to do it, you'd go up to over 1,000. So again, knowing this environment, we just got to do it right. Joe?
Back to the budget shortfall and what steps you might be able to, might have to take this summer if there's no federal aid package. Are furloughs on the table at some point? You mentioned that there haven't been any yet, but are furloughs on the table through this summer?
So the question is about the state budget and what we'd have to do moving into the summer. We don't believe. So first we have to balance this fiscal year, and that ends June 30th. We believe that while there would be pain there would not be furloughs, and they wouldn't be effective because there's only a couple months. Next year, the forecast is going to be rough. We are going to need and we expect federal assistance. We are hearing better negotiations coming out of that, but if states and local governments hit just as hard as state governments don't get that aid, we're going to have to look at a number of options. But I'm going to do everything I can to prevent any furloughs or layoffs, because that just it exacerbates a recession. And what we've seen in every recession is if government has to lay people off, it just spirals it and makes it that much worse. So we're gonna look at all plans, but I'm gonna work very, very hard, whether it is pushing the federal government to provide the assistance they provided in 2008 and 9, or coming up with a plan that wouldn't take those steps. I'll read one last one. were resolutions by Clark County Fiscal Court and the City of Nicholasville to reopen on a county-by-county basis. Factors in my decision on timing to reopen. We read all of them and all the plans that came in. We looked over them. A lot of them are based on the White House plan, just like ours. But the reason that we've got to move forward as one state is we've got to be able to test and contact trace. And the testing, we're ramping up, and counties can't bear that load. So we got to make sure that we do this gradually as we build up all that capacity. So we're going even longer than we normally do. But I appreciate everybody sticking with us. And I don't just mean that today in this press conference. I mean it through every day we've been dealing with this virus. Remember, a test of humanity isn't short. We don't get through it very quickly. Tests are supposed to be hard, and this is hard. I know we're anxious. I know we're restless, but it's being able to battle those feelings that helps us to protect others around us. You've been asked a lot, and you're going to be asked a lot more as we safely transition to healthy at work. So I know we've got a video on teacher appreciation as we leave. Thank you to our teachers. Thank you to everybody out there. We'll get through this. We'll get through this together. Thank you, Virginia. Thank you, James. Thank you, Kenneth at home.
This song is for those who inspire us today.